Corla, I welcome the opportunity to make a contribution in relation to this important debate, and I want at the outset to wish my colleague, the Minister of State, Kathleen Lynch, well in the task ahead, and I know that she has a deep personal interest in this matter. And I want to also pay tribute to the groundbreaking work done by Deputy Dan Neville over the years in terms of highlighting this issue. I recall a number of years ago, but 15 or 16 years ago, inviting Deputy Neville out to UCD when I was involved with the Students' Union in that college, and I recall the very interesting and inspiring presentation made to students by Deputy Neville. I want to acknowledge the work that he has done over the years. Suicide rates in this country, Corla, have reached disturbing levels. A national consensus is required, a determined, forthright and inclusive national effort to save lives in the face of this crisis. In the second 3 months of 2010, the CSO records that 127 people took their own lives. This deeply troubling rate of suicide continues to climb each year. The National Office for Suicide Prevention on its own website refers to these climbing figures as, I quote, a worrying trend, and I completely agree. It is frankly a national emergency which requires all of us in positions of responsibility to build towards a comprehensive national response. And what makes this situation particularly disturbing is the fact that the frequency of suicide is highest amongst men in their 20s. In fact, there is an emerging trend, as we're all aware, where instances of suicide are occurring at a much younger age than was previously the case. This is a deeply troubling fact and requires the attention and focus of us all. In terms of mortality rates, recorded incidence of suicide now exceeds the number of road deaths recorded, and this has been the case for a number of years. When we switch on the news generally on a Sunday morning, it's not uncommon to hear of multi-vehicle car crashes across the country claiming a multiple of young lives. That same weekend, in fact, there may have been several cases and incidents of people having made the tragic decision to take their own lives. Suicide, of course, is an entirely different matter, a different, relatively silent but equally painful phenomenon and experience for those who have been left behind as well. Of course, we don't hear about it the same way we do as with road crashes, for example, and it's treated differently by the media and for very legitimate reasons. And I want at this stage, Corla, to acknowledge the responsibility shown by the media, both locally and nationally, right across the country, in terms of the sensitivity demonstrated and expressed and the care and professionalism shown in general by them in relation to the coverage of instances of suicide, its aftermath and how the matter in general is dealt with. There's an enormous amount of work, as expressed by colleagues, done by the National Office of Suicide Prevention and organisations such as one in my own constituency, the Save Our Sons and Daughters organisation, in relation to this issue. They're all dedicated to dealing with this multifaceted and complex social challenge. As a public representative, and since this deep recession hit, I have seen a sharp increase in relation to the number of people experiencing serious distress and mental health difficulties. Some indeed have confided to me that they have at one stage or another considered taking their own lives. Public representatives, quite frankly, each and every one of us here in this chamber, and councillors and senators right across the country, are in the front line. And can I say this? It's important, I believe, that TDs and all public representatives are, in a sense, guided by the relevant agencies to be able to identify people who are at risk and people who are in difficulty, and insofar as practicable, given the confidential nature of the relationship that Dáil deputies have with their constituents, to direct them to the people who can support them best. It would be more than useful, I think, if agencies made themselves available and if we could all work together to try to develop a model and develop a framework where we could be better equipped to deal with the issue ourselves and to ensure that we can direct people to the relevant supports and agencies. We need as well to break the silence and tackle the stigma around mental health. We need to engender a culture of openness and frankness where discussing one's mental health is in some respects seen as a strength rather than as a weakness, and that has been the case in our society, unfortunately, up until now at the very least. We will have the opportunity soon to embark on a review of the 2001 Mental Health Act, and we should take that opportunity to do some, I think, very simple and straightforward things. And we ought to emphasise much more the need for mental health services to be brought into the open, and to resource, I think, community-based organisations to engage better with those who need mental health service support. I accept that strides have been made already in this regard, but much more needs to be done, and I look forward to working with the Minister and everybody with an interest in this issue in the House to move the issue on and to make sure that we have the best possible services to those who need them most. Thank you.
Thank you, Deputy.